Hi, I'm Melissa from DASCO Home Medical Equipment. Thank you for choosing DASCO. I'm going to show you a little bit about the sleep machine that you'll be using at home. The settings on this machine may vary according to the results of your sleep titration, and the sleep technician will set the machine accordingly for you. Here's an overall look at what you'll be taking home. You will get a bag that everything will pack up into. You can use this bag for travel or transport of your machine at any time. You will also receive the machine, an operator's manual, a mask of some sort that the sleep technician will fit you for, the tubing, and you will also receive a packet of information from DASCO. This will contain all the important information about cleaning and replacing your supplies, as well as all of our contact information. Now let's take a closer look at operating your machine. In the back, you will find a place to connect the power cord. You will also find a filter. It is dark gray and it's a spongy material that will just pull out. You want to take this out on a regular basis. You can brush it off between your fingers, and it is also reusable. You can wash it with soap and water like you wash your dishes and let it air dry. You will find an extra filter in your bag. You may also find a white filter, which is an extra fine filter you may use if you have a lot of allergies to dust or pollens. The white filter is disposable. Also in the back, you will find an SD card. This is spring-loaded, and you can remove it from the machine. This keeps track of some important information in the usage of the machine. This may be important for your doctor, as well as most insurance companies do require that we get a download from your machine to prove that you're using it, so they will continue to cover your supplies. Now back to the front of the machine. To the right side is a heated humidifier. This is for your comfort so that you're not getting dry from using the machine. There is a small lever on the front and you'll want to pull up on that. There's a canister inside that will come out. And we do recommend that you use distilled water in this canister. There is a fill line on the front, and you can fill through the top. By using the distilled water, you won't be getting the deposits and scaly buildup that you would get from your tap water. It is very important to keep this canister clean, and we do recommend pulling this canister out each morning and dumping any remaining water. You can open the lid by putting your finger in the center hole and squeeze. This lid will easily come off. There's a little tab right here on the lid, and that's what you need to release. You can wash this canister out with soap and water like you wash your dishes, and you can also use a vinegar and water solution as a good disinfectant. To put it back on, you'll first want to start in the back, and then it will latch into place. On the bottom there is a metal heater plate, and there is a heater plate in the unit itself because it does heat up just a little bit. That will slide back in there. You want to push it all the way in and close the lid. To attach the tubing, you'll notice that one end has a gray connection and some clips, so that will attach to the top of the unit here. To remove it, you'll squeeze the side tabs and pull it off. Once you have your water in the canister, you're now ready to start your sleep therapy. To turn the machine on, you'll want to look at the window and make sure that the therapy square is highlighted. If any other square is highlighted, you just simply turn the dial until you see therapy is lit up in a dark color. To turn the machine on, you just hit the large circle one time. This will start the air through the tubing. The machine will come on to the set pressure that is ordered by your physician. This machine also has a feature called a ramp. And this button down here in the corner, it also has a triangular shape on it. If you push that one time, it will lower the pressure. And this will temporarily lower the pressure and gradually increase back up to your set pressure over a 20-minute period. This will help you get used to the machine and be a little bit more comfortable while you fall asleep. You can activate the ramp feature at any time during your therapy by pushing the button. You will also notice that there are some numbers that light up around the circular knob. These numbers correspond with the heat and humidification setting on your machine. The higher the number, the higher the amount of moisture and humidification you will get. The lower the number will be lower both. 0 is off for the heater plate. If you're waking up in the morning or through the night and you feel that you have a dry mouth or dry sinuses, you may want to try increasing this number one setting at a time until you find something that's more comfortable for you. To stop the airflow and your CPAP therapy, you just simply push the button again one time, and that will bring you back to the main screen where you see the 4 squares. Now just a quick review on what you will do each night. We do recommend that you start with fresh distilled water in your canister each night. When you're ready to start your therapy, you turn the machine on simply by pushing the large circle one time. This will start the pressure, and if you choose to use the ramp feature, you'll push the ramp button. Remember, the ramp feature is just for your comfort, and some people choose not to use the ramp feature. If you need to make any adjustments in your humidification, you will turn the dial and watch the light up numbers. In the morning, to stop your therapy or turn the machine off, you simply push the large circle button again, one time. Keeping your supplies clean is very important. Everything can be washed in soap and water like you wash your dishes. The tubing can be rinsed out and hang over a towel rack or shower curtain to drip out and air dry. The canister comes out of your machine, and it's very important to keep that clean. The mask can also be washed. The headgear can be washed by hand and let it air dry. And you'll also want to keep the cushion and the rest of the parts of your mask clean as well. The cushion is the part that touches your face, and this is removable and replaceable. Please refer to your DASCO packet for more details on cleaning and a replacement schedule for your supplies. Thank you again for choosing DASCO Home Medical Equipment. I might be pretty good at guessing that this is not something that you had on your bucket list of things to do in life. However, we at DASCO want to help you get positive results from your sleep therapy. Please don't hesitate to call us if you have questions about your equipment or supplies. It is our mission to help you breathe, sleep, and feel better.